You are about to view the process of collecting blood for patient diagnostic or monitoring purposes from a finger puncture. The patient's arm must be supported on a firm surface, with the hand extended and the palm up. A young child may have to be held on the lap and restrained by a parent or guardian. Select a site in the central fleshy portion and slightly to the side of center of a middle or ring finger that is warm, pink or normal color, and free of scars, cuts, bruises, infection, rashes, swelling, and previous punctures. Warming makes blood collection easier and faster and reduces the tendency to squeeze the site. Warming is not normally part of a routine fingerstick unless the hand is cold. CLSI recommends 70% isopropyl alcohol for cleaning capillary puncture sites. Cleaning removes or inhibits skin flora that could infiltrate the puncture and cause infection. Letting the site dry naturally permits maximum antiseptic action, prevents contamination caused by wiping, and avoids stinging on puncture and specimen hemolysis from residual alcohol. Select a fingerstick lancet according to the age of the patient and amount of blood to be collected. Verify lancet sterility by checking to see that packaging is intact before opening. Open and handle aseptically to maintain sterility. Select collection devices according to the test ordered. Place items within easy reach, along with several layers of gauze or gauze-type pads. Remove or release any lancet locking mechanism. Hold the lancet between the thumb and index finger. Grasp the patient's finger between your non-dominant thumb and index finger, holding it securely in case of sudden movement. Keeping the skin taut at the site of the puncture will aid in puncturing the skin at the correct depth. Place the lancet flat against the skin in the central fleshy pad of the finger, slightly to the side of center to avoid bone injury, and perpendicular to the fingerprint whorls so the blood will form easily collected drops and not run down the fingerprint. Warn the patient. Make the puncture and discard the lancet in the sharps container. Apply gentle pressure until a blood drop forms and use a clean gauze pad to wipe it away. This prevents contamination of the specimen with excess tissue fluid and rids the site of alcohol residue that could prevent formation of well-rounded drops and also hemolyze the specimen. Collect subsequent blood drops using devices appropriate for the ordered tests. Hold the microcollection tube below the blood drop. Touch the scoop to the blood drop and allow it to run down the inside wall of the tube. The tube may need a gentle tap occasionally to settle blood to the bottom. Apply pressure with a clean gauze pad and elevate the site until bleeding stops. Examine the site to verify bleeding has stopped. Apply a bandage to the site and advise the patient to keep it in place for at least 15 minutes. If bleeding persists beyond 5 minutes, notify the patient's nurse or physician. Seal the tubes when full and mix the additive tubes by gently inverting them 8 to 10 times. Specimens must be labeled with the appropriate information. Affix labels directly to microcollection containers. Place microhematocrit tubes in a non-additive or aliquot tube and place the label on this container. Follow any special handling required.